Welcome, my dear friends. Myself, Professor Dr. Rajendra Raghuveer Deshpande from Pune, Maharashtra State, India, would like to welcome you all in my Ayurveda Academy YouTube channel. In the last two lectures, I have given you the list of Roganidan paper 2, which important diseases will be asked in the examination and which important diseases are important for your medical practice. For both, I think nearly I have given the list for 30 diseases. Among that, we have completed many. Today, we are going to see an important disease. Usually, these patients are admitted in the Ayurvedic hospitals and long case taking is done with the Udara Vyadhi. So write down the title of the today's lecture. Udara is a lecture of Roganidan, Vikriti Vijnana. Paper 2 we are discussing. But my dear friends, these lectures, Deshpande's lectures, are also liked by the common man. All the doctors, professors, they are very interested to hear Dr. Deshpande. Oh, today is Ascites. Dr. Deshpande will talk about Ayurvedic aspect of ascites. Ascites. Fluid in the peritoneal cavity. Fluid. Write down basic things. What is Udara? Fluid, Fluid, in the peritoneal cavity. Around your abdomen, there is a two-layered membrane, which is called as a peritoneum. In the lungs, we have also double-layer membrane, which is called as a pleura. And when water is accumulated in the pleura, it is pleurisy. छातीमध्ये पाणी झालं, in the Marathi language we say पोटात पाणी झालंय. There is accumulation of the fluid in the peritoneal cavity. The name is Udara in Ayurveda. My dear friends, I will tell you the name of 3 diseases. Will you please write down? Please write down.
Sir, voice is not audible.
My mic was little bit in a not proper. Okay, are you now? Can you hear me?
Yes, sir. Yes, sir.
Yes, good, good, good. Thank you very much. Thank you very much. My dear friends, hands up. I am sorry for the last few minutes. I think 2 or 3, 4 minutes. My voice was not audible because my that particular mic has lost the charging. Anyway, now you can hear me. Okay. So thank you very much, my dear student, to intimate me properly, and you can always welcome to tell me like that. Okay. Good, good, good. I was discussing about Ashtau Mahagad. First, I told you that Udara, Grahani, and Rudroga. The name of the Vyadhi and name of the organ, same. Name of the Vyadhi, name of the organ, same. That is why they are difficult to cure. Then I mentioned the word Ashtau Mahagad. Ashtau means 8, number 8. Gad disease. Gad Vyadhi or disease. Mahagad. So amongst that 8 diseases, Udar is one of the disease. So Udar ascites is not easy to cure. It will take a long time to treat these patients. Okay. So Udara is a accumulation of fluid in the peritoneal cavity. I think everything now very clear. And now we will start to discuss one point after another. First, we will discuss about the definition. Charaka Sutra Sthana 18/31. Yasya Vataha Prakupit. Vata Prakupit is there. So write down Vata Prakupit. V for Vat, P for Pitta, K for Kapha. V for Vat, P for Pitta, K for Kapha. So Vat is Prakupit. What are the properties of Vata dosha? Tatra ruksho lagushitaha khara sukshmaschalo nilaha. Tatra ruksho lagushitaha khara sukshmaschalo nilaha. Anila means Vata. So whenever the patient is not drinking enough water, always taking the dry food stuff, always having the AC, always moving, physical and mental stress, Vata dosha will be prakupita. Then it will attack on the tlak, skin, mausam, antar ashritaha, shotham janayet. Edema will be there, swelling will be there, kukshi, udara tasya jayate. There will be swelling around the umbilicus in the part of abdomen. So the definition is the disease or vyadhi which is related with the abdomen. Abdomen is protruded like the obese people, like a pregnancy. So there is a lot of differential diagnosis, lot of DD. Please write down DD, differential diagnosis. Vyadhi, Vyavachedaka Nidan, Ayurvedic terminology. Vyadhi, Vyavachedaka Nidana. So examiner will ask you, why you are saying that this is Udara? The examiner will say, no. I think this is fat. He is obese person. If lady is there, he will say, no, this is not ascites. She is pregnant. She is pregnant. Another case, lady is there. No, this is not ascites. This may be uterine fibroid, tumor, uterine fibroid. So these are the 4 diseases: obesity, ascites, pregnancy, uterine fibroid. Decide how you will decide. They said this is a water inside. So of course the final is there that you can do the sonography and everything will be clear. Now we have the very good test, abdominal USG, ultrasonography. But I will tell you the little more about afterwards. Okay. So Udara, Vayu gets prakupita, stay in between the tvacha and mounds of abdomen. It is related with the only abdomen. Remember, Shoth can be anywhere in the body, but Udara can be only related with the abdomen. So there will be edema related with the abdominal skin, abdominal muscle.
but basically it is a skin problem, peritoneal membrane problem. Hence, this Vyadhi is known as Udara, Uchcheda. Upward swelling is there. So, Udara. Okay. Next, you write down the types. Please write down the types. 8. First, write down the number 8. 8. This is very important. 8 Udara. Types of the Udara, 8. Now, 1, 2, 3, 4, 5, 6, 7, 8. You write down sequence in your notebook. Start writing. First, V. Second, P. Third, K. Fourth, VPK. What is VPK? Tridoshaja, Sannipatika. Next, fifth, Yakrut Plihodar. Can you see here? Yakrut and Pliha swelling. Yakrut is liver, Pliha is a spleen. Yakrut Plihodar means there will be fluid in the abdomen, but due to the problem of either liver or spleen, there will be hepatomegaly, there will be splenomegaly plus water. Okay, Yakrit Plihodara. Next, Baddha Gudodara, obstruction in the colon. Baddha Gudodara, Chidrodara, perforation. Please write down Chidrodara, perforation, and Dakodara or Jalodara. Dakodara or Jalodara. I will tell you, Jalodar is not the same as Jato Dakavastha. At this moment, I request each and every student write down these two words. This Jalodar is a different disease. Jalodar is a different disease, and Jato Dakavastha is one of the avastha stage in the Udara Vyadhi. Please write down Jato Dakavastha is avastha. It is a particular stage, and Jalodar is a different. This is a disease. Okay, let us start. Next point. So here you can see the hetu. That is the causes. Ati Ushna, Ati Lavana, Ati Kshara, Vidahi, Amla, Garashanat, Mithya Sansajana, Ruksha, Viruddha, Ashuchi Bhojana, Pliha, Arsha, Grahani, Dosha Karshanat, Karma Vibhrmat, क्लिष्टान्नाम प्रतिकारात रौक्षात वेग विधारणात स्रोतसाम दूषणात आमात संक्षोभात अतिपूरणात अर्शो वात शकृत्रोधात आंत्र स्फुटन भेदनात. Write down the chapter number, Charak Chikitsasthan, chapter number 13. So when we will see the Charakuttarartha, we will drop this. We will not repeat. No, why we should repeat? Because it is we have already studied. Okay. So there are two types of hetu. One is a pitta prakopak and another is a vata prakopak. So please write down V prakop and P prakop. Now for P, ushna, very hot, pungent, spicy, irritating, mutton rassa, tamda rassa, vada pav, only the green chilies, mircha, very hot, always pickles, eating all the time pickles, chutney, raw mango chutney, raw mango pickle. So this is very bad. Then kshar, vidahi, amla, sour food substances, toxins, garvish, viruddha, and aswachha, uncleanliness, unhygienic foodstuffs. Especially here, I would like to tell a little comparison. Because when we talk about taking something irritating and hot, most important for the liver, the dangerous substance for the liver, visha, toxin for the liver is madhyapana. Please write down this thing, madhyapana. Alcohol. Because of the alcohol, liver is damaged. Always. Basically, ascites is related with the liver. Please write down, ascites is related with the liver. Because Yakrita, liver, is a moola sthana of Rakta Vah Srotasa. Liver is a big factory, and that liver is damaged because of the alcohol. So alcohol, pitta prakop, liver damage. After few days, after few years, liver cells totally damaged. First, it's the only what you can say the hepatitis. Can you write down alcoholic hepatitis? Okay. Next, you write down. Then there will be liver cirrhosis. CIRRHOSIS. Liver cirrhosis. First, only infective hepatitis or the alcoholic hepatitis. Then next step is a liver cirrhosis. Then next step is a ascites. And last stage, liver cancer. You need the liver transplant, but less chances to survive. Patient will die. So don't forget, liver can make you die. Tell your patients, don't drink alcohol because it becomes addicted and then gradually your liver totally damaged. First, alcoholic hepatitis, inflammation, then cirrhosis. What is cirrhosis, sir? Fibrosis of some cells of the liver, cirrhosis. Then ascites, accumulation of fluid in the peritoneal cavity. And last stage is, oh, bad luck, liver cancer. Then death. So these, all the sequence you must remember with the ascites. And that is why I'm telling that Ushna Tikshna, it also includes not only green chili and mango, etc., chutney, pickles, but alcohol, drug addiction. These are all Pitta Prakopak. Don't forget these. Don't forget alcohol in Udara Vyadhi. Okay? Then also they have said something like the diseases. For example, if you don't treat the proper diseases like Arsha, Grahani, they are interlinked. Because the main reason in these all the diseases, please write down Agnimand. Agnimand. Metabolism is disturbed. This is very common. When your liver is not working, how your metabolism will be good? Tell me. It is not possible. Why? Why, sir? Because the liver is responsible for protein metabolism. Liver is responsible for carbohydrate metabolism. Liver is responsible for fat metabolism. So when liver is damaged, how your Agni will be proper? So Agni Mandi will be there. Try to understand. Then Vata Prakopak, here can you see Atirukshapan, without water, without milk, without beverages. Vegavarodh. Do you remember the shlok? Na Vegandharet, Vata, Vind, Mutra, Shavatrikshudam, Nidrakasa, Shramashvasa, Jurumba, Shruk, Chardiretasam. Sir, once more. Na Vegandharet, Vata, Vind, Mutra, Shavatrikshudam, Nidrakasa, Shramashvasa, Jrumbashru, Chardiretasam. These natural urges should not be suppressed. If you want to go to toilet, go to the toilet. If you have the defecation reflex, go to the toilet. If you are hungry, eat something. If you are thirsty, drink water. But some people are not taking good care of these urges. That is very bad. Okay. Then here you can see, apart from these other hetus, sometimes the shoth can be occur is one of the Rudroga, which is called as a cardiac edema. Of course, this is not directly related with the Udara, but yes, indirectly it can be related. So Rudroga can cause also indirect influence to get the problem in the like ascites. Then Vrukka shoth, kidney problems. Okay. Then Chirakari Yakruta shoth, just now I have alcoholic hepatitis, Rajyakshma, and Antravarudha shoth, Antravaran, colitis. So all these are the secondary causes or tertiary causes. Now, most important is a Samprapti. Please write down the title, Samprapti of the Udara. First is the Charak Chikitsastan. Can you see here? Rudva. Stop. Stop. Rudva means stop. Rudva sved ambuvahini doshaha srotansi sanjitaha pranagne panan sandushya janayeti udaram nranam. Sir, once more. Rudva. Rudva sved ambuvahini doshaha srotansi sanjitaha pranagne panan sandushya janayeti udaram nranam. Nruna. What is that? Nruna? Nruna? Nruna. Human being, man or woman, we human being, nrunam. When there is obstruction in the sved vah srotas and ambu vah srotas, there will be srotorodha, and then pranavayu is disturbed, jatragni, pachaka pitta, apanavayu, all abdominal or bioenergies, they will get disturbed, and then you get the udara vyadhi. Next. The Nidan is the best textbook of the Roganidan. Can you see here? Nidan, best book for diagnosis the diseases. Nidane Madhavaha Sreshta Charakastu Chikitsite. Nidane Madhavaha Sreshta Charakastu Chikitsite. Charak is giving you the principles of treatment. Nidan, diagnosis. What Nidan is saying? Rogaha sarvepi mandegnau sutram udarani cha. Rogaha sarvepi mandegnau sutram udarani cha. He says all the diseases from cold to cancer, the basic reason is Agnimandya. And say Udara Vyadhi, definitely there is Agnimandya. He is saying that. Next. Can you see here? Now we will discuss the English part of it. Agnimandya. Please write down these keywords. Agnimandya. When you talk about Udara, don't forget the word Agnimandya. Then what is that? It begins the Samprapti pathogenesis. Then there is Am Utpatti. Second important word. There is always Am. Always Am. Toxin-like material. Then Strotorodh. Next Samprapti. Strotorodh because of the Am. Then Malasanchaya. Please write down Mala Sanchaya. And then Viguna Grahani, Viguna Gati. That means it will be diverted to the unwanted channels. It will not, Anuloma Gati will not be there. Proper stools, proper urine will not be there. And that whole, what you can say, the pathophysiology will occur in the abdomen. Sanchaya Prakopa Prasara of local Poshya Dosha. Final products like pranavayu problem, apanavayu problem, then avarodh, obstruction of ambu ambu means water, and svedavah srotasa. So it is related with the, because fluid is accumulating in the peritoneal cavity. So where is fluid? Fluid is from ambu srotas, fluid is from svedavah srotas. Are you getting? Okay. Adman and Gaurav, heaviness. Gas will be there. These are the Lakshana, and which arise in Udar due to the Vyadhi Swabhava. Later on, sorry, I will move slowly up. Okay. It will later on, Abhyantara Tvacha and mouse of Udara, local, gets vitiated, leading to the Udaka Dhatu and Annasara part becoming Vimarga Gamana and Upasnehana Nyaya. Please write down this word. Upasnehana Nyaya. I will use 5 times. Upasnehana Nyaya. Upasnehana Nyaya. It's like osmosis. Okay? It's like osmosis process. Attracting principle will act over there. Now we will go further. Now, entering and filling the potential space, that is a Sajala Avastha. Okay. Collection and finally Udara Vyadhi will develop. Now we will talk about the Purva Rupa, the warning signals. Purva Rupa. Tat Purva Rupam Balavarna Kanksha Vali Vinasho Jatrehi Rajya. Jirna Pradjnana Vidahityo Bastu Rujaha Padagatascha Shofaha. This slok is from Sushruta Nidanasthan, chapter number 7. Most important is a lack of strength. Physically, he will be very much weak because liver has damage. Liver is responsible for metabolism. To get proper proteins, proper carbohydrates, proper fats. No, liver is bekar, damage. So that's why there will be loss of strength. Then varna will be lost because luster, complexion, तेज चला जाएगा. पूरे शरीर की जो रौनक बन जाएगी, आपका इतना, आपकी स्किन अच्छी नहीं रहेगी, आपका ग्लो चला जाएगा. हाँ, मुखमंडल के द्वारा निकला हुआ, क्योंकि ब्लड सर्कुलेशन अच्छा नहीं रहेगा, एनीमिक कंडीशन, पांडु होगा वहां पर. ठीक है, ये सब हो जाएगा. उसके साथ साथ डिजायर फॉर फूड, दैट इज and other things in general, there will be, see, here is a lack of bala, lack of varna, and lack of desire for food. Don't get confused. This lack word is attached to bala, this lack word is attached to varna, this lack word attached to the for food. Are you getting my point? Pururupam balavarna kamsha. This will be lost. Desire for, there is an anorexia. Please write down anorexia. Very simple thing I will tell you, my dear friends. Do you know the common problem of liver? Can you judgment? Yes, jaundice, correct? So what is the important symptom in the jaundice? Yes, yellow color is there, but basically kaman lati iti kamala. No desire to eat anything. No desire. So again there will be weakness. So this will be the vicious cycle. दुष्ट चक्र बन जाएगा. पहले तो आपको खाना नहीं जा रहा है, तो आप कम खाएंगे, तो वीकनेस बढ़ जाएगा. वीकनेस बढ़ने से और आपकी हालत बेकार हो जाएगी, और आपको खाना नहीं खाना की दिल करेगा. तो दिस विल बी द कंटिन्यूअस बैड साइकिल, विशियस साइकिल. Okay, then there will be loss of wrinkles over abdominal wall because inside there is a fluid. So wrinkling will be lost and it will be tight, stretch, like the stretch, because inside there is a fluid and it is stretching the skin of the abdomen. Stretching the skin of the abdomen. Inside there is a fluid, lot of fluid inside. So stretching, so loss of wrinkles, presence of dilated and tortuous capillaries. This is very important. Please write down the word portal hypertension. Please write down portal, P-O-R-T-L, hypertension. That means there is a srotorod in the liver, and from the lower extremities, from the lower abdomen, the impure blood is entering into the liver, and from the liver it is entering into the superior and inferior vena cava and coming to the heart. But as the liver is damaged, that blood cannot enter into the liver, and there is a back pressure. There is a back pressure at the whole abdomen. The blood is not going into the liver because liver is srotorod, obstruction, kam chalu rasta band. Work is in progress. We are damaged, so don't come to me. So there is a portal hypertension, and that is their veins over abdomen. Dr. Deshpande is simultaneously explaining with the modern understanding, and that is very much essential. Very few colleges, very few teachers, they make such type of the nice comparison with the modern knowledge and Ayurveda. That is very important. Okay. Then Anna Vidah, naturally the food digestion will be not proper, pain in the lower abdomen, and what pedal edema will be there, bipedal. On both the feet, there will be edema. Next. But pedal edema is more common when there is a heart involvement. Remember this. Then kidney involvement, this is periorbital swelling. Periorbital swelling. Kidney problem in the morning, here. In the morning, periorbital, around the eyes, swelling. Pedal edema, heart, and liver, ascites, central swelling. Central swelling. Okay. Now we will talk about Rupa. Rupa means Lakshana. Rupa means Lakshana. Can you see? Admanam gamane ashaktim Daurbalyam durbal agnita. Shotha sadanam anganam. Sango vata purishayo. Daha tandracha sarveshu jatareshu bhavanti. Repeat once more. Madhava Nidan, diagnosis. Nidane Madhava Sreta. Admanam Gamane Ashaktim. Daurbalyam Durbal Agna. Durbal Agnita. Shotha Sadanam Anganam. Sango Vata Purishayo. Daha Tandracha Sarveshu Jatareshu Bhavanti. Adman, gas in the stomach, decreased moving capacity. The person feels so weak that he cannot walk here and there, cannot do the regular exercises. Daurbalya. Then Agnimandya. Metabolic process is on the lower side. Shot, edema will be there. Angasad. Whole body is like draining out. Energy is drained out. Vayu, Mutra, and Purisha Sang. Flatus passing, no. No belching, no gas, no, nothing. Mutra avarod, oliguria, purisha sang, constipation will be there. Dah, whole body will start burning. Tandra, like a giddiness and drowsiness will be there. Okay. Next, Vyadhi avastha. This is the most important part, my dear friends. Come on. Vyadhi avastha. Vyadhi avastha, most important. Please write down. I will wait for you. Most important of this lecture, most important, write down, Vyadhi Avastha, Vyadhi Avastha. 1, 2, 3. 1, 2, 3. Oral question, most important. Write down 3 names. Ajato Dakavastha. No water. Udaka means water. Ajato Dakavastha. Absence of fluid. Ajato Dakavastha. Next. Pichila Avastha. Pichila Avastha. Little bit fluid accumulation. Little. Pichila. And then Jato Dakavastha. Udaka, water. Jata, coming. Water is there. Jato Dakavastha, that is the fluid stage. This is the most important part of this disease or of this chapter. How to examine ascites patient? My dear friends, Dr. Professor Deshpande has a mobile app, Ayurveda Academy, the same name of YouTube channel. That app is available on your smartphone, Google Play Store. Please download the app, free. Don't worry, be happy. Then there are 12 to 13, 15 programs are there. One of the program, clinical examination, very few money, no more money, only few. That purchase that particular program and you will see how that examination is done for this ascites patient. Very important. Okay. So, Ajatodakavastha, Vayu is Pratiloma, important word. Atopa will be there. Then capillary network will be there because Vata is making that designs. Stambha in Udara, pain in the umbilical region, Vangshan inguinal region, back pain, kati pain will be there, Mala Baddhata, constipation, and Mutra Sangha, oliguria will be there. Pichilavastha, first Agnimandya, Ama formation, toxin, Dosha Sanchaya, Srotorodh. So what will be the Srotos Avarodh? Sved Vaha Srotas, stop. Ambu Vaha Srotas, Srotorodh, stop. काम चालू रास्ता बंद ऐसे बोलेंगे वो स्रोतस feeling of pitchil dravya or slimy substance. Abdomen will be bulging. Size becomes rounded. Your abdomen becomes rounded. There will be heaviness in the abdomen. Then there will be percussion, will show the dull note. Normally, if air is there, that is tympanic note. But this is dull note. Very important finding. When fluid is inside, Please write down dull note, percussion. Tum tum, tum tum, tum tum. Can you see? Here. For example, here is my abdomen on this side, my face side, abdomen, and I am making the percussion. Please see my videos. Percussion, how to do the percussion. But percussion, dull note. Don't forget, dull note. Because water is inside. Water. So normal, which note, sir? Which sound? Please write down. Resonant note, normal. Your abdomen, my abdomen, his abdomen, her abdomen, tum tum, tum tum, resonant, because air is there. Now in this patient, fluid is there. Okay, next. Sorry. Jatodakavastha, upasnehan nyaya. Please write down. Upasnehan nyaya. Water will be attracted, fluid accumulation will be there, and the increase of girth. You should have the measuring tape. For seeing the ascites patient, each medical student should have the measuring tape, and girth should be measured of abdomen around the umbilicus. Okay, that is very essential for the diagnosis. Now, can you see capillary network which was visible previously now disappears because lot of fluid is there. Umbilicus becomes flat. This particular umbilicus in ascites, can you write down these all the things? Very, Dr. Deshpande has self-written some notes. Laughing umbilicus is a characteristic feature of the umbilicus in ascites. Laughing umbilicus. I will show you here. Umbilicus will be stretched like this. Again, see my face. Transverse diameter. Umbilicus will be laughing umbilicus. This is typical name. Don't forget this. You write in the examination, laughing umbilicus. Then I have already explained about the mobile app, clinical examination, but you write down these two names. Horseshoe shaped dullness. Horseshoe shaped dullness. And another word, shifting dullness. Sorry, my dear. I will not explain here. No, sorry. Please check the app. Please check the app. You will see all these things. Okay. Horseshoe shaped dullness and shifting dullness. Now, this is the printing mistake. So I have made this cross. No resonant note. It is abnormal. This is dull note. Now we will see one by one the symptoms of Vataja Udara. Can you see? When Vata, always pain. Pain is Vata. Pain is Vata. Pain is Vata. Edema, irregular. Upper and lower limbs, in the umbilical region, in the Kukshi region. Pain. Pain in the abdomen. Pain in the backache. Pain in the Kati region. Udara, Prishtha, Parvasandhi. Then Shishka Kas. Shishka Kas. Dry cough. Angamarda. Oh my God. Everywhere paining. Angamarda. Then Malavashtamba, constipation, sudden increase or decrease in the girth of abdomen. Very irregularity is Vata. Vishama is a property of Vata. Vishama. Todavat and Bhedavat Vedana. Severe pain will be there. Okay. Now we will, for the Pittaja, we are discussing Pittaja Udara. Pittaja, P. What is there? Fever. Pitta is always with the fever. Murcha, giddiness will be there. Burning, daha will be there. Trishna, lot of thirst will be there. And brahma, giddiness will be there. Early accumulation of abdominal fluid. Usually, try to understand, very important concept. Vata and Pitta diseases are more times acute. Acute. Only last 2 days, only last 3 days, only last week. But Kaphaja, last few months. Kaphaja, last 2 years, last 5 years, last 10 years. So Chirakari, chronicity is a speciality of Kapha. Ashukari, instant, Vata and Pitta. Is it clear? Okay. For any disease. Now, Kaphodara. Can you see Chirabhivruddhi? Can you see? Just now I have mentioned. I will mark for you so that you can concentrate over here. Can you see this word? Chirabhivruddhi. Kathina, hard. Kapha is always hard. Pitta is soft. Pitta is soft. Okay. Angasad, debility of the whole body, energy has been drawn out. Sarvanga Shodh, which is called as, here is the word, Anasarka. Anasarka. Then Atinidra, all the time sleepy. Aruchi, loss of taste. Shwas, breathlessness, because lot of fluid here and there will be pressure on the diaphragm. Pressure on the diaphragm. Diaphragm is a main muscle of respiration. Fluid in the abdomen and that gives the pressure on the diaphragm. Simple. So breathlessness is very common. Please write down. Is not asthma. Is not asthma. Breathlessness. Because diaphragm from below there is a pressure of the water. Udara vyadi, jatodakavastha. Okay. Then there will be Udara feels hard, abdomen will be hard, slow growth of its circumference, like that. Now we will go further. Fourth type, that is Sannipatika. I will mark you for. Don't worry, be happy. Sannipatika. All the three doshas are disturbed. There is a problem with the Viruddha Anna Sevan, incompatible food stuff. Mixing banana water, banana milk, fruits and milk shakes. Everything is Viruddhan. There are 13 types of Viruddhan. Desha Viruddha, Matra Viruddha, Prakriti Viruddha, etc. etc. So you have to take care. Garavisha and Dushivisha Sevana, toxins, food poisoning, Tridosha Prakop will be there, and there will be Murcha, unconsciousness, Shosha, dryness, weight loss will be there, Brahma will be there. Okay. Next is a Plihodara or Yakruta Dalyodara. I will mark for you. Okay, don't worry. Here, Pliha means spleen. Please write down. Pliha, here Pliha, spleen. Can you tell me when the spleen is enlarged? Splenomegaly. Please write down. Splenomegaly. Megaly. In normal person, our liver and spleen is not palpable. Please write down. In normal person, liver and spleen not palpable. But when there is a pathology, liver is enlarged, one finger enlargement, two finger enlargement, three finger enlargement, liver, hepatomegaly. If there is anemia, destruction of RBCs, spleen is a graveyard of RBCs. उधर पुरते हैं हम, जो ब्रेक हो जाते हैं ना आरबीसीज, कहां पर वो जाकर मरेंगे? वो स्प्लीन में जाकर डूब जाते हैं. तो इसलिए जब भी whenever there is hemolytic anemia, स्प्लीन का आकार बढ़ जाता है. स्प्लीन का आकार बढ़ जाता है. पूरे के पूरे डेढ़ जो आरबीसीज है उधर आकर पड़े हुए हैं. वो उसको खत्म करना है ना, प्लीज स्प्लीन को, उसको ज्यादा एक्टिवेट होता है तो एनलार्ज हो जाता है. समझ में आ गई बात? तो स्प्लेनोमेगाली. ठीक है. Why? Ayurveda has a specific own concept of diagnosis, traveling in a cart immediately after meal. That means moving around immediately after food that can disturb the digestion process. Remember, ati vyavaya, excessive sexual activity, intercourse, then there will be raktadushti, and that because pliha, as I have told you, is related with the RBC destruction. So that is a raktadushti. That is anemic condition. Hemolytic anemia, splenomegaly. Okay, next. What are the symptoms? Lakshanas, Shwasa, Kasa, Pipasa. Can you see? Shwasa, breathlessness. Kasa, cough. Trishna, excessive dryness in the palate, in the throat. Then Pandu, this is most important. Splenomegaly is related with the hemolytic anemia. Then there will be Murcha, giddiness, Chardi, then Dah, Moha, and Agnimandi. You don't forget to write down Agnimandi everywhere. Actually, because of the anemic condition, the patient can get the little bit fainting attacks. Next point is, sorry, the Kodar. I think in the beginning of the lecture, do you remember I have mentioned that this Jalodara is a different disease. Please write down. And Jato Dakavastha. Don't get confused. In the practice, many people say, oh, Jalodar, Udara, Jato Dakavastha. No. Jato Dakavastha can happen in the different types of Udara Vyadhi. But Jalodara is something very acute condition, serious condition, and emergency. Okay? When patient made and mouse become shilled, weight loss will be there, tremendous. Maybe because of the cancer, maybe because of the HIV, maybe because of the tuberculosis. Because Agniman, the metabolic process has been damaged in the liver cirrhosis. So this Jalodar, typical Jalodar, can be a final stage of liver cirrhosis. Remember. So tremendous weakness will be there. Vata and Kapha Prakopa will be there. All of a sudden, within last week, the patient starts swelling in the abdomen and lot of fluid in the abdomen. Okay, and that's why there will be dull note. Now I am going to the next page. Sadhya Sadhyatva. My dear friends, but let us complete this Nidan, and then if time permits, I will comment 1 or 2 sentences about Chikitsa. Please, mind this Sadhya Sadhyat. This is, Udara is one of the 8 difficult diseases, Atto Mahagada. So this Vyadhi is a Dushchikitsa. Dushchikitsa. Very difficult to cure. Krichra Sadhya. Krichra Sadhya Vyadhi, difficult to cure. All types of the Udara are Kashta Sadhya in nature, right from their birth. It can become Sadhya with great efforts if Rugna is very strong, Balavan. If there is a Jalasanchiti is very, very few, recent, then Vyadhi is also recent, not many years, only 1 month. Then Jatodaka Avastha has not occurred yet, only there is a Pichalavastha or Ajatodaka Avastha. Of these, then Baddha Gudodar, but this is what we can control. But when there is a Baddha Gudodar or Chidrodar, death, fatal, emergency, okay? Then the patient mostly die, Ayurveda says, within 15 days. Very serious. Vataja, Pittaja, Kafaja, Yakrita Plihaja, Sannipataja, and Udakaja, Udara are Kashta Sadhya. Udara Vyadhi becomes Asadhya if there are these particular symptoms like severe Parshvashul, very severe pain in the abdomen, Anannabhilasha, don't want to eat for many days, recurrent Jalasanchiti. If Jalasanchiti is too much and too much breathlessness is there, modern doctors, physicians, surgeons, they do, please write down, abdominal tapping, Tapping, abdominal tapping, put a trocar and cannula, take the fluid slowly out. Remember, in the ascites fluid drainage, it should be drained very, very, very slowly. If you take don't shame out, the patient will die. Shock will be there. So don't do that. Slowly and steadily, this is a specific skill. Pleural tapping, abdominal tapping. You have to learn this technique during your internship. Very important. I request, although you are practicing Ayurveda, don't lose this opportunity to learn how to take out the fluid from the ascites patient. Okay? So, Udara Vyadhi becomes asadhya if severe Parshvashul, Anannabhilakshan, recurrent Jalasanchiti after the Virechana. Yes, here comes the point. Ayurveda has said in the Udara Vyadhi, the best Panchakarma is Virechana. Write down, give the laxatives. There are 3 important Virechak Dravyas in Ayurveda, in Panchakarma, Jayapal Kalp, Jayapal products, please write down. Ashwakanchuki. Oh, sir, please. Yes, I will say 3 times. Don't worry, write down. Ashwakanchuki. Oh, interesting name, sir. Tablets are available in the market. Go to the medical shop and ask him, see the label on the bottle. Ashwakanchuki or Ichha Bhedi. Ichha Bhedi. And third, Narach Ras. Narach Ras. Ashwakanchuki Ichha Bhedi Narach Ras. Ashwakanchuki Ichha Bhedi Narach Ras. Ashwakanchuki Ichha Bhedi Narach Ras. Very important Virechana Kalpas, medicines in Ayurveda. These medicines are given early in the morning. Full day, he passes the 15, 16, 20 times loose motions. Relief in the abdominal fluid essentially. It will gradually reduce. These patients are kept, they are asked to don't drink the water. Don't drink the water. The most important pathya for ascites patient, dugdh ahar, milk diet. Yes, write down. Even Vaidyas are keeping this patient 3-month milk diet, 6-month milk diet, only milk. Siddha milk, simple milk, warm milk, without fat milk. All these type of the milk treatments are given in the ascites vyadhi and nityam enam virechayam. Okay, so here, asadhya, when there is a, yes, I think it's everything has been cleared. Whenever there is a perforation, acute abdomen, that is very difficult to cure. Then netra shodh and upastha shodh. Falling lakshana should not be treated if the tvaka becomes thin due to the excessive jalasanchiti, rakta and mausa kshinata, weight loss is there, anemic condition is there, balahani is there, shoth in trimarma, your heart has problem, your kidney has a problem, your brain neurological problems, then these patients, there should be warning. Actually, Ayurveda cannot say that I will not treat this. But you inform to the relatives and tell that this is a very serious condition. I will try my level best, but the rest will take care of by God. I will do my best and God will do the rest. This should be your statement while treating this very, very difficult to cure type of the condition, asadhya vyadhi. Okay, so this is all for today's lecture. We will meet tomorrow for the Sri Roga Prasudhita Tantra. Thank you very much for your nice cooperation. Please don't forget to share and like the video and subscribe my YouTube channel. Press the bell button icon to get the interesting, simple, nice videos by Professor Deshpande. Wish all the best. Take care and see you soon.